a large cohort of patients with AKI treated with CRRT in ICUs. We found a high CRRT liberation failure rate and poor survival and kidney-related outcomes. In addition, we found successful CRRT liberation was independently associated with improved kidney recovery, but not with lower 19-day major adverse kidney event. My name is Chang Liu, a physician in the Department of Critical Care Medicine, Zhongnan Hospital of Wuhan University, mainland China. I completed my research fellowship at Mayo Clinic under Dr. Kiroshi B. Kasali, a consultant in the divisions of pulmonary and critical care medicine and nephrology and hypertension, Department of Medicine, Mayo Clinic, Rochester.
This is Dr. Ziong Pan, Professor and Chair of Critical Care Medicine from Zhongnan Hospital, Wuhan University, Wuhan, China.
Here, we would like to share some of our findings in the article titled Continuous Renal Replacement Therapy Liberation and the Outcomes of Critical Care Patients with Acute Kidney Injury. This article will appear in the November 2021 issue of Mayo Clinic Proceedings. This single-center retrospective cohort study included 1,135 adult patients admitted to Mayo Clinic ICUs with AKI and treated with CRRT from 2007 to 2018. At 72 hours after the first CRRT liberation attempt, only 20% of the cohort were successfully liberated from CRRT, and 39% of the cohort required RRT reinstitution. Compared to successfully liberated patients, those who required RRT reinstitution had nearly twice the duration of dialysis and the need for mechanical ventilation. In addition, their ICU stay was 6 days longer and their hospital stay was 9 days longer. Furthermore, successful CRRT liberation was independently associated with the increased probability of kidney recovery within 90 days. However, its association with 90-day mortality and major adverse kidney events was not significant after adjustment for all known confounders.
In the current clinical practice, there is lack of evidence to guide CRRT liberation. The determination is mainly based on the physician's personal experience. The high rate of the liberation failure in our study reflected the variations in the current clinical practice. In addition, we also found that unsuccessful liberation was associated with the worse kidney-related outcome, longer ICU and hospital stay, more resource utilization. Although the causal relationship cannot be established, promoting the CRRT liberation might be a desirable goal from both patient's perspective and healthcare costs. Furthermore, our finding underscored the need for more clinical data guideline councils to support clinical practice of CRRT liberation.
It was surprising that the benefits of successful CRRT liberation or consequently improved kidney recovery were not observed in 19-day survival or major adverse kidney events. It had been known that RRT reinstitution could expose patients to additional risks of CRRT-related or hospital-acquired complications. However, the causative relationship between these complications and AKI patients' outcomes had not been comprehensively reported. Furthermore, the relationship between CRT liberation and AKI outcome, particularly in the long term, had not been prospectively examined. Therefore, there is a possibility that in AKI patients, successful CRT liberation does not causally contribute to survival and major adverse kidney events, but instead is a consequence or a marker of the severity of the underlying illness. Further research is needed to prospectively examine the impact of CRT liberation on the outcome of AKI patients. Thank you for listening, and we hope you enjoy the article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.